This presentation is very simple, and the main message I want to get across is that even at an extremely junior level, with little to no experience in the healthcare system or your medical education, you are able to produce new ideas that do benefit clinical practice, and you are able to do research. You can also do research with next to no help and also next to no resources. Obviously, there's degrees to this, but I just wanted to give that message to start off with. For me, it was a very empowering message when I first learned about it, and if you take one thing away from this, it should be that. I also want you to remember, as we go through this talk, I want you to remember the phrase PICOT pie. I put a picture of a pecan pie, or however you pronounce it, but it will reinforce a couple of memory tricks for you that will give you a framework for forming research questions and also doing your own research. Really, the goal from this workshop series is we want you guys to go on and do your own research to improve clinical practice in whatever way you want to. So, before I get into the actual framework, I want to bring back to the reason that we do research in the first place. Really, that is to innovate. And to understand or really think about the word innovate, we need to get back to the etymology of it. So innovate or innovation just means creating new stuff. So anything that's new, you can call it innovation. And it's a pretty cool thing because any of you who do a project or create anything new, you can be called an innovator. I think that once you understand this concept, that research, creativity, innovation, they're all very similar concepts, it will take you a long way. So why do we innovate in healthcare? Well, it's just for improvement. My philosophy is that research should be about creating some sort of improvement within the healthcare system, whether or not it's our understanding, whether or not it's something measurable for patients, whether or not it's something measurable for the healthcare system. Anything that has some sort of improvement in any form, I think, is meaningful research and meaningful healthcare innovation. And to reinforce the concept of innovation, I want you to think of cooking. Now, cooking, it obviously meets nutritional needs. We need to cook our food. However, there's an art side of it. There's a creative side of it. Obviously, there's different ranges of the degree of resources you can pour into cooking or the types of food that you can cook. And we range from people like me, who can barely cook at all, up to Michelin-grade chefs. And to draw it back to why we do healthcare research, I want to give this quote from Gordon Ramsay, or unverified from Gordon Ramsay. So he talks about, so when people ask me, what do you think of Michelin, which is essentially the world-renowned grading system for the top restaurants in the world, he says, I don't cook for the guide, I cook for the customers. And we should always think that as clinicians or clinical researchers, we should always remember that that improvement should eventually translate to better patient care and outcomes in some way. So further developing on the idea of cooking as an analogy for healthcare innovation, how many of you have seen The Matrix? Yeah? Do you remember this scene? Well, this scene, to just sort of refresh for all of you, is pretty much when they're in the Matrix, or they see everything as it is, they're eating food that's essentially slop. It's extremely tasteless, there's no joy to eating it. However, it serves all the nutritional purposes. This is really an extreme form of goal setting and identifying what improvement you can make in your research. This, if you draw an analogy, it could be just if we wanted a project that focuses only on patient outcomes. However, if we want to enhance something like taste, it could be drawing an analogy of improving the system outcomes. So I just want you to have that in the back of your mind. Obviously, before we start making any sort of food, we need a recipe. So to draw the analogy, the pecan pie again, but when we're doing research, we need guidelines and we need frameworks. And even if you don't know the individual guidelines for what you're doing, I want you to have some sort of conceptual framework of a start and an endpoint for the different research or the healthcare innovation that you're going to undertake. If you want to find relevant guidelines easily for your necessary study design, the Equator Guidelines is a website that you can all look up. Then, after you've got a recipe to follow, you need the ingredients. So these ingredients can vary, but for any problem or any food that you want to cook, you do need at least a core set of ingredients. As you try to experiment and as you get better at cooking, you can throw in like a bit more of a certain ingredient, or you can even throw in different ingredients. Or if you travel overseas, you can draw from different cultures or different countries and their types of food. But you do need a set of ingredients to start from. After this, you put the ingredients together. And there are a set of steps where if you mess up the order, you're not going to get the good product. However, you could experiment with different orders of putting the different ingredients together, and similarly you could also experiment, every single aspect of putting the ingredients together you could experiment with. Then it comes to cooking the food. There's the length of time that you could cook the food. There's the oven that you bake the pie in. There's the fancy add-ons to the oven that you could put. All of it comes back to the same sort of things that you have to consider when you're doing your research project. Then obviously once you pull it out of the oven and once the food is cooked, you have a finished product. However, this is not the end of the story. You need to think, who are you going to serve it to? How are you going to serve it? And then after that, do you just want the fact that you've gone through all this process to remain with the people eating the food? Or if you've really learned something from this cooking process, do you want to communicate that a bit further? There's obviously some differences in the way that you present your meal. And then obviously if you're really proud of what you've done, you probably want to share it. So an easy way is communicating this online for lots of people to see. And then this starts an open discussion between people where other people may share their ideas on how to cook a pecan pie. And then you can develop together essentially how to develop the best recipe, the best way of putting the ingredients together possible. So all innovation and all research, it really starts with an idea. And this is what I want all of you to start doing once you go away from here, is start trying to come up with your own ideas. The way I do it is I simply think, okay, in clinical practice, or if I haven't been in the hospital setting yet, the thing that I'm studying, how will this affect patient care? Can I think about some way to better understand this concept? And can I think of any way that we can improve this in any form? Now, that can simply be making a process within the healthcare system more precise. Even if it's a minuscule amount, that can have a measurable difference for patients. So drawing back to the etymology of the word idea, it simply means to see. So you see something in the system that you can potentially improve, and then in its development of the word, the next phase was form or pattern. So can you look and see in the system and then form a pattern of how to implement your idea? How do we innovate? Well, essentially, like everything in our lives, we want to be goal-directed. Some of you may have seen the SMART acronym, which just means you're specific about your goals, you're measurable with how you set the goals, you need to have it reasonable and attainable, it needs to be relevant to what your idea is, and also needs to have a time-based component as well. The same logic we should use for innovation. Now, I get to the point of the talk where we actually go into official healthcare research frameworks. Now, the first one I want you to think of is the FINER framework. Now, this is really about when you've come up with an idea, what are the different characteristics of the idea should you consider? Within the FINER framework, the first one is feasible. So essentially, if you have a great idea that's not achievable in any form, and it's not realistic, it's never going to happen. If you do have ideas like that, I would put them aside, and maybe in the future you could reach up to them. Then it has to be interesting. Now, I don't particularly agree with that choice of word. However, one thing it does emphasize is that there is a lot of subjectivity in the interpretation of ideas and research. So whether or not it's interesting to you, it may not be interesting to other people. the replacement I would put for this is improvement. So it has to be some sort of improvement to the system. Then obviously a novel, because you're doing some sort of innovation. And then it must be ethical as well. Many of you would have heard of ethics committees and ethics reviews. Essentially, what you're doing to try and improve patient care has to be within our ethical bounds, and you have to be extremely strict about this. Then it also has to be relevant to the healthcare system as well. And within this, you have to consider what scope you're implementing this. If you develop an intervention that's applicable in Adelaide, but then try to implement it in America, it may not have a measurable benefit. So you really have to think, okay, is it relevant to my context? Then what are the components of a research question? And this is where the PICO acronym comes in. And this is where I want you to think back to the PICO pie. So what are the components of a research question? P stands for population. So what cohort of patients are you thinking about? I or E, they're used interchangeably within the literature, is either intervention or exposure. So what are you doing, or what are you changing? What are you exposing the patients to actually measure? Then you have to have a comparator, if they're available. That can be interchanged with just standard care, or if you're just looking at the intervention itself, you can ignore that. But O is probably the most important thing. Your difference that you're looking at has to be measurable. Outcome just means what is the thing that we're measuring. That's all outcome means. It's synonymous with endpoint, and it's synonymous with measure or metric as well. That, I think, is the most important thing when you're designing any research question or trying to make your ideas into some sort of innovation. What are we measuring? And then the final part is T, or time. So what time frame are we looking at? Are we looking at just a snapshot in time, or are we going to follow up these patients for years to see how this exposure changes them? Then, after you've developed the research question, the next step is essentially the oven, or whichever way you want to use the analogy, putting the ingredients together in some form to make a final cooked product. So that's where you go to the evidence hierarchy and you pick your study design. So you may have heard people throw around the term of like level 1 evidence or level 4 evidence. All that means is how strong is the methodology that we're using. Now, the bottom of the screen, level 4, is just case studies, which is single patients where they're not really reliable. We can't really trust that a single patient's experience is going to be translatable to the entire population. And the highest, and this is a common misconception for people, the highest is not a randomized controlled trial. The highest is actually a systematic review, which is a review of the literature following strict international guidelines of randomized controlled trials, or a synthesis of randomized controlled trial evidence. Essentially, the evidence hierarchy goes from bottom to top, is going from the lowest possible quality of reliability of evidence up to the highest trustworthiness in the evidence. That's all I want you to take away. There's obviously different research and feasibility considerations with each study design. So when you've got your research question, have a look at what's been done already in that area, and then think, okay, what is a feasible thing for me to do with my means at the moment and the research question I'm developed, and pick your study design accordingly. And then I think a very important part about research or innovation that I think a lot of people miss is that the story doesn't end with the study. The story ends with the communication of the study. Like when you've baked the pie, if you eat it immediately, only you will know about it. However, if you then give it to a giant dinner party or serve it at a banquet and then they go around and tell everybody, all their friends, about how amazing your pie was, then word is spread and everybody knows how good your innovation was. So it's always important that when you've done some sort of healthcare innovation, you think, how much do I want to communicate this to wider society? That can either be in written form, in the form of papers or peer-reviewed publications. However, there's also use in non-peer-reviewed publications, such as newspaper articles or catalogues or other sort of forums. Then verbal presentations, such as this one, can be useful. And then an important thing that a lot of people don't consider is audiovisual. So use in engagement with the media or characterizing your intervention or your research in some form that can be communicated around the world. I want you to just take away that when you're doing research or coming up with your own ideas, you need to have a framework as you're going through, and you need to have a start and an end point. If there's one thing that I want you to take away from this, it's just remember PICOT. Thank you.